Hello all. Today's topic is osteoporosis. Osteoporosis is a disease that weakens bones and makes them much more likely to fracture. It makes bones thinner and less dense than they should be. Bones are usually dense and strong, enough to support weight and absorb more kinds of impacts. As you get age, your bones naturally lose some of their density and their ability to regrow themselves. If there is osteoporosis, bones are much more fragile than they should be and much weak. Patient might not know they have osteoporosis until it causes to break a bone. Osteoporosis can make any of bones more likely to break, but the most commonly affected bones include hips, wrist, and spine. Then, about symptoms. It does not have any symptoms the way that lots of other conditions do. That's why healthcare providers sometimes call it as silent disease. The most common symptom is suddenly breaking a bone, especially after a small fall or minor accident that usually don't hurt. Even though osteoporosis does not directly cause symptom, we might notice a few changes in body that can mean bones are losing strength or density. The warning signs of osteoporosis include losing an inch or more of height, change in natural posture like stooping or bending forward, shortness of breath if discs in spines are compressed enough to reduce lung capacity, then low back pain. Then causes. It occurs when the creation of a new bone does not keep up with the loss of old bone. While aging is the most common factor, bone density is influenced by a complex mix of genetics, hormones, and lifestyle choices. First of all, we can say about hormonal changes. Hormones play a vital role in maintaining bone density. When these levels drop, bone reabsorption often takes place bone formation. Estrogen deficiency, the most common cause in women, especially during menopause. Then low testosterone in men gradually declines in testosterone as their age can leads to bone loss. Overacting glands like hyperparathyroidism or overactive parathyroid and adrenal glands can cause excessive bone loss. Next, nutritional and lifestyle. Low calcium intake, vitamin D deficiency, tobacco and alcohol consumption. Medical conditions and medications. Certain secondary causes can trigger osteoporosis even in younger individuals. Medications, long-term use of corticosteroids, anti-seizure medications, gastric reflex drugs, that is proton pump inhibitors, and cancer treatments. Medical disorders, celiac disease, eating disorder, and chronic kidney or liver disease. Then risk factor, age. Older age or at high risk. Sex, women are much more likely to osteoporosis develop than men. Body frames, people with small body frames are high risk because they have less bone mass to draw from as they age. Then family history. Diagnosis. It typically focus on measuring bone mineral density, that is BMD, because the condition has no symptoms until a bone breaks. First of all, DEXA scan is done. It uses very low level X-ray, absorbs about 10% of radiation of a chest X-ray. It calculates how many grams of calcium and other bone minerals are packed into a segment of bone. Then lab testing. While blood test cannot diagnose osteoporosis in its own, we can rule out secondary causes like vitamin D deficiency or thyroid issues. Blood urine test to check level of calcium and vitamin D levels. X-ray and CT scans are done. Then treatment. Osteoporosis treatment has two primary goals: preventing fracture and strengthening existing bones. Anti respirative, which slows bone loss, then anabolic therapies, which actively build new bone, then anti respirative medication. Bisphosphonate can be taken as weekly, monthly pill, or once a year IV fusion in IV fusion. Then Denaswamp injection given every 6 months. Then hormone related therapy for women. Then bone building medications anabolic, that is it is used when high risk of fracture. Then essential nutritional support, calcium, vitamin D are given. Then sun exposure, lifestyle changes like weight bearing exercise, yoga are done. Thank you.